Hello ladies, I'm Dr. Paul. Today I want to talk to you about estrogen levels and menopause and what that has to do with your weight management. So for those of you who are past age 52 or have gone through surgical removal of both your ovaries, you will have statistically very low levels of estrogen. So prior to menopause, estrogen levels are the main drivers of hair, skin, nail health, mood, and sexual health. So that, and I would even argue in women, testosterone is also the driver of sexual health for women. So, but those estrogen levels are super important in terms of managing those things I just mentioned, but also when estrogen goes away, women's bodies tend to experience kind of a redistribution of body mass. So women notice an increase in belly fat, because those women who have low estrogen levels tend to get higher degrees of belly fat. So I would say that correcting, or I should say normalizing that estrogen level to healthy premenopausal levels in those women who can safely do that is one way that we certainly would approach women who are postmenopausal, who are struggling with belly fat. So who can do that safely? So in my clinic, I typically will offer hormone replacement therapy to women, particularly those women who are very close to menopause or have gone through menopause in the last few years. If they don't have any history of blood clots, they don't have any history of breast cancer, and they don't have any migraines with aura. So a migraine with visual spots prior to getting those migraines. So breast cancer, blood clots, and migraines, and also those women who smoke. Sorry, smokers. We have to quit smoking before we can do estrogen. So that typically helps with the estrogen piece of the hormone puzzle as it relates to weight management. So we'll talk a little bit about kind of perimenopausal women in another video, but certainly want to address estrogen as a driver for increased belly fat because it's a thing. All right, thanks.